washing my hands. My name is Kinsey. I'm going to be your student physical therapist today. Can you tell me your name and date of birth, please?
Chazzy Jones, 06/17, 1995.
Okay. Is it okay if I work with you today?
Yes, it is.
Okay. What brings you into therapy?
I've been feeling this pain kind of at the top of the front of my thigh here.
Front of your thigh right there?
Yes.
Okay. When did that start?
I would say it started about 2 weeks ago. I'm a marathon runner, so.
Okay. So you.
It started about 2 weeks ago.
Okay. Have you been able to run since?
I haven't ran
you've
since.
Been laying off of the running?
Yeah.
Okay. Do you think you were doing anything specifically when it started, or did it kind of just come over time?
I think it just came over time. I had a few injuries before.
Okay, what kind of injuries did you have?
I tore my ACL.
Okay.
That was the only thing. But what I'm going through now isn't similar to the
Doesn't
ACL.
feel the
It doesn't
same?
feel like that. It's just very irritating.
Did you have surgery on your ACL?
Yes.
Okay. About how long ago was that?
That was about 10 years ago.
Okay. Did you have PT after that?
Yes.
Did you have a good experience with PT?
It was good. I didn't make it to full recovery, but
But
I still think it was good.
beneficial?
We did what we could.
okay. Do you feel like the pain at the top of your knee like fluctuates, or is there certain things that you do that makes it feel better or worse?
Well, I've been just resting, icing, trying to elevate it. Things I looked up and they told me to do.
Okay.
But I know what's your question?
Oh, sorry, I interrupted.
I know when I start to straighten my leg out, that is probably the most pain that I get.
Right there at the end.
It's a sharp pain right there at the end.
Okay. Does the rest in the ice and the elevation, does that seem to help?
Seemingly, I mean, it kind of makes me feel better about myself that I'm doing something, but I don't know if it's not fixing the problem.
Okay. How would you describe the pain right there? Would you describe it as like sharp, dull, burning, throbbing, constant, intermittent?
I would say when I try to straighten my leg out, that is sharp pain.
Okay.
And anytime when I sit down into a chair, it gets sharp when I reach that ending point of sitting down.
Okay.
But otherwise, it's just like an achy, bothering pain.
Okay. What would you say your pain is on a scale of 0 to 10, 0 being you feel fine, 10 being like take me to the ER right now?
I would say it's about a 2.
A 2
right now.
Okay, what about when it's at its best?
When it's at its best, probably about a 2.
2, okay. And then when it's at its worst?
At its worst, it gets up to about a 6-ish.
Okay. And you said straightening your leg aggravates it, and when you sit all the way down like that sometimes aggravates it. The rest in ice may help ease the pain a little bit, but you don't know if it's actually fixing the problem. Okay.
Perfect.
Does it hurt more in the morning or the night, or is it just kind of constant?
I would say more when I get home at night after I've.
Okay. Have you had any pain there before? I know you had your ACL surgery, but
I
pain
never felt any pain.
Okay. And you had surgery on your ACL. Have you had any other surgeries?
No.
Okay. Are you on any medicines that I should know about?
No medicine.
Are you taking any medicine for the pain?
No.
Okay. You said you're a runner and you haven't been running since. Do you do that for work or a hobby?
That is a hobby.
Okay.
I work at in motion wellness, so I'm on my feet all day.
Okay. Have you been able to do that with the quad pain?
Yeah, I'm pushing my way through it.
But it hurts.
It hurts.
Okay.
It's kind of bothersome. I wouldn't say it's excruciating pain, but I can definitely feel it hurts all the time.
Okay. And just right there at the top of that knee. Okay. And it is your left knee.
It is my left.
Okay. Do you have any history of heart attacks, high blood pressure, diabetes,
No.
anything, any medical history that you think I should know besides your ACL? Okay. Have you noticed any like bruising, scarring, or swelling, redness up above your knee?
Say very minimal swelling,
Okay.
but not too much.
Okay. Okay, so So I'm just gonna go through what we've been through just to make sure I got everything. You're having pain at the top of your left knee. It started about 2 weeks ago. Kind of just happened over time. You did have a previous ACL injury with surgery 10 years ago, but you don't think that that has anything to do with it. It hurts when you straighten your leg out to the end point right there, and when you sit. You've been doing ice, rest, and elevation. You think it might help with some of the pain, but you don't think it's fixing it. And it's preventing you from running, which is your hobby, and you feel it when you're working, which is not fun. Is that right?
Yes, that is correct.
Okay. So we're gonna take a look at a couple of things and see if we can figure out what's going on with your knee. Let's see. The first thing I want to do is I just want to look at how you stand. I just want to look at how everything's aligned. Sometimes I'm going to be looking at your hips, your knee, and your ankle today, because sometimes if you have even problems at your ankle or your hip, it can go down to your knee and cause you to compensate, which could cause the pain. So we're just going to take a look at everything just to make sure that we're getting a whole picture, okay? So the first thing, do you have any balance problems or tripping or anything like that? Okay. The first thing I'm going to have you do is just stand up, and I'm just going to look at your pelvis, your knees, and your foot just to make sure everything's lined up good. Do you have any pain when you go from sit to stand?
A little.
A little?
A little.
At the top of that knee still?
Yeah.
Okay. Your pelvis looks aligned. You don't have any knee valgus or knee varus. Ankle alignment looks good. Looks good from the side. Do you have any pain when you walk in that knee area?
Yes.
A little?
Yeah. It's
just kind of constant?
Yeah, it's constant. It's here.
Okay.
And it lets me know that I feel it every time.
Okay. You don't use an assistive device, do you? Okay. You said you have a little swelling. Have you seen any discoloration or any? Okay. The next thing I want to do is I just want to see how you walk. I want to see if you're, again, having any compensations. So if you can start at that wall and just walk towards the end of the bed, you walk like you normally do. I'm just going to look. Okay, and then you can just go back.
I feel like I'm limping a little.
Limping a little?
I feel like it's a little, like I don't want to step out with this.
Like a painful
Left
walk.
leg is my, yes.
Okay. The next thing I want to do is I just want to look at your motion. So I'm going to have you lay back. Would you like a pillow?
I'm good.
Okay.
Wait, I'm good.
Do you want one?
I'm good.
Okay. The first thing I want to do is I want to measure your knee. You said it's your left knee, right? Okay, so we'll look at this one first. I want you to drag your heel all the way towards your butt. See how far you can go. Okay, that's good. No pain on that side?
No.
Okay, I'm gonna have you flatten it back out. Okay, that's good. And then while I'm here, I'm gonna go ahead and look at your ankle to make sure there's nothing going on down there. Can you bring your toes all the way towards your nose as far as you can? Okay, and then point your toes all the way to the ground. Any pain with that?
No.
Okay. Now I'm gonna do the same thing on the other side. Okay. Same thing, can you just drag your heel to your butt?
Get a little painful here.
It's painful there, okay. Alright, and just straighten it back out. Was that painful? Straightening it out?
Not really, I kind of just let it go.
Just let it go, okay. Now I want you to bring your toes to your nose on this side. Any pain with that?
No.
Okay, and then just point your toes to the ground. Okay. Alright, so can you bring your heel back towards your butt? I'm gonna push on it and I want you to tell me if this is still painful.
Yes.
Still painful? Okay. I'm gonna have you lower your leg back. Have you had any hip pain at all
No,
that you can
maybe
tell?
lower back.
Lower back?
Maybe lower back.
Okay.
Only on his right side too.
Only on just the right side?
Just the right
The
side.
opposite side of your knee pain? Okay. We'll take a look at your back too. I just want to make sure I do everything laying down first. Let me write down these numbers. Okay. I'm gonna have you sit back up. There's one thing that I forgot to do, and this is just gonna look at gross motion overall. I should have had you do this while you were standing. So we're gonna stand up, and I want you to bend over and touch your toes if you can. Do you have any pain with that?
No.
Okay. What about when you just look up towards the ceiling and run your hands down your back?
No pain. I do feel this right side of my back tighter.
Just, okay. Now we're gonna put hands to the side and just go side to side like that.
This actually feel good.
That feels good. How about that side? Not bad. Okay. The next thing I want to do is we're gonna combine it. So I want you. Well, first we'll rotate. Just go side to side like this. Any pain with that? Okay. Now I want you to do the kind of the same thing where you run your hand on the back, but turn and look over.
Okay.
Another side. Any pain with those? Okay. You can sit back down. Now we're gonna look at your hips, knees, and ankles. So can you march for me? Any pain with that? Okay. Kick your legs out.
Ouch.
That hurts. Okay. And what about coming
That's what
back?
I can hear. Yeah, that hurts.
Hurts too. Okay. Can you open and close your legs like that? Like a jumping jack? Any pain with those? Okay. Now do windshield wipers with your feet. Any pain with that? Okay. What about bringing your toes to your nose and pointing out? Any pain with that? Okay. Can you wiggle your toes? Any pain with that? Okay. The next thing we're gonna do is test your sensation. And all that means is I'm gonna touch you like this with your eyes closed and you're gonna tell me if it feels same or different, okay? Okay, so close your eyes.
Same.
I would have you take your shoes off and socks, but you want to. Okay. So now we're gonna test the strength of your muscles. I'm gonna start on this unaffected side first. I'm gonna put you in a position and apply resistance, and I don't want you to let me move you, okay? So the first position is we're gonna raise our knee up like right here. Don't remove you. Okay, any pain with that? You just let me know at any point if there's pain, okay? Now I'm gonna push your leg back, don't remove you. Any pain with that? Okay, don't remove you. Any pain with that? Okay, pull your toes to your nose, don't remove you. Push the gas. Good, and then just bring your big toe up. Good. Okay, now I'm gonna do this side again, let me know if you have any pain with any of these. Bring your finger. Okay. Don't remove it. Okay, did that hurt? Don't remove it. That hurt?
No.
No, okay. Bring your toes to your nose. My fingers are popping. Press the gas. Okay, and then just bring your toe up. Okay. Anything with the rest of those? Just the one where you're pulling this way?
Where I was pushing out against
This
you.
way? Okay. Okay. Just take note of that. Okay, I do want to look at a couple more muscles while we're looking at your strength. Do you care to lay on your side?
Which side?
We'll start with this side on top, so facing that way. Sorry. Okay, so I'm gonna come behind you. And what I want you to do is I want you to lift your leg up to my hand. Same thing, I'm gonna apply resistance, don't let me move you, okay? Okay, and then if you'll just, while we're here, I'm gonna length test your IT band and your TFL. So I'm just gonna move your leg. You don't have to do anything. Good. Okay. And now I'll have you flip the other way. Sorry.
Oh, no, maybe I could have turned it a different way.
No, that's okay. Same thing. I'm gonna test the strength of this. Okay. Okay. And same thing, I'm gonna look at the length of your IT band. So this table might get in your way back here. It's good. Okay. Do you care to lay on your stomach for me? Now we're going to take a look at your hamstrings. So we'll start on this leg. Gonna have you raise, that's your glute max, never mind. Gonna push against your leg, don't let me move you, okay? Good. Same thing on the other side. Don't let me move you. Good. Okay. While you're on your stomach, I'm gonna take a look at your back on this side where you said it was hurting. What I'm gonna do is I'm just gonna push on your spine back here just to feel how your joint is moving. So I'm gonna look at extension first. Do those feel normal? Okay. Rotation to the right. Does that feel normal? Okay, and then I'll go ahead and look at left rotation too. Does that feel normal? Okay. Alright, I'm gonna have you sit back up.
I guess it kind of, when you was pressing that on the right side, I guess it felt a little more restricted than
It feels
the left.
stiff.
Yeah,
Do you
it
feel like-
felt more stiff on the right than it did the left.
Okay. Okay, I wanna look at one more thing just to look at, muscle length of your hip and your knee at the same time. So what we're gonna do is I'm gonna have you come to the edge of this table. I'm gonna raise you just a little bit up for my sake. And I want you to hold one of your knees, yeah, like that. And then we're gonna go back. Okay, Leo, so guys, you're touching the table, so it's not that.
I feel like my knee can go back if I
Scoot
think
it back a
I
little
think
more.
I'm too.
Okay, we'll sit you back up. Now we're gonna do the other, you wanna do that side again,
Yes.
just to make sure. That was my fault. I'm
Uh-oh,
sorry.
maybe not. What does it look like?
That looks like 90, so that's good. And now we'll sit back up and do the other side. Okay. Okay, I'm just gonna measure that real fast. Okay. Sit back up, I'm gonna write that down. That side was a little more limited than the other.
Yes.
Have you had any numbness or tingling or anything like that? Okay. Now lower you back down so your feet can touch.
This table got a diagonal.
Yeah, I know, and that table back there gets in the way. I've already looked at your sit to stand.
Mm-hmm.
Do you have any problems going up and down stairs at all?
Yes.
Stairs
I
bother you?
forgot about telling you that. Yes.
Okay.
They bother me a lot.
Does going up bother you or going down? Or both?
Both.
Both. Okay.
I would say going down feels more unbalanced.
Okay.
Having to control my descent.
Does it feel like wobbly? Like
Yeah.
Okay.
It hurts.
Okay. But you said you haven't had any balance problems or anything like that. Okay.
When I come down, when I'm walking up the stairs, I can kind of muscle through the pain and
Yeah.
just step up. When I'm going down, I like to hold on.
Okay. That makes sense. Okay. The next thing I want to do is look at how your joint is moving. I'm going to take a look at your knee and your hip. You did have a little bit of weakness on the same side of your hip muscle right here called your glute med. So we want to just make sure that that's not a joint problem and look at that. So what I'm going to have you do is lay back again. Sorry. I'm going to first look at your patellar mobility. So all that means is I'm going to use my fingers and I'm just going to move your kneecap around and see how it moves, okay?
Okay.
Okay. You let me know if there's any pain and I need to stop, okay? Did that hurt? Okay. Put the other side down. His kneecap sits a little higher.
That knee has never, since my ACL surgery, it
Go back to normal.
never really got. I don't know. I still feel like it's swole for some reason. Yeah.
Well, whatever you got going on at your knee right now might be contributing to that.
Could be,
So,
yes.
how was that knee happening, or was it okay?
I would say when you were taking the patella down towards my feet, it felt a little tight in that muscle in the quads.
Okay. Yeah, I definitely felt that. The next thing I'm gonna look at is your hip. I'm gonna grab my gait belt and do distraction just to see if that feels better. I know you said that you don't really feel like you've had any hip problems, but do you feel when you walk, I didn't notice it when you were walking, but do you feel like your hips do anything weird when you walk? Does that make sense? Like, do you feel like it's dropping or?
I don't feel like it's dropping. I do feel like my right side hip up to my lower back works harder than the left side.
Okay, yeah, that makes sense. So just hip and back over here.
Basically, yeah, it's just overworking. It's just working everything.
Okay. And that could go in with what I was telling you about how looking at the joints above and below, they can sometimes contribute to compensation at your knee. So that could cause the pain. Okay. So I'm gonna have you bend this leg over here up. Is that bend good? Like that? Okay. Nice. Now I'm gonna bring your leg up like this. And this is just a mobilization to see how your hips will feel. Does that feel better or worse or anything weird?
Nothing weird.
Okay.
It does feel good though.
Feels good. Okay, gonna do the same thing on the other side. But that's the hip that's bothering you.
Yes.
Okay.
Not a major bother.
Just, you can feel it.
I feel like when I walk, I do feel like I like to favor that right side more.
It's fair. Okay. that there. Is that okay right there?
Yes.
Okay. The same thing. Anything over here? Okay.
Does feel good.
Feels good. Okay. So the next thing I'm going to do is what we call special tests. And what that does, that just rules out other things, or it could rule in something and tell us exactly what's going on, okay? So the first thing I'm going to do is I'm going to do it on this leg here. I'm going to have you bend your knee up to about 90 like that. And we're just going to look at your ACL right here. Okay, so that's negative. I'm going to bring it down to about 30. Negative. Push it back up, sorry. Going to look at your PCL. Negative. Really doesn't move. Okay. Go ahead and do those on the other side real fast. See if they feel the same. You let me know if there's any pain or any you're feeling, okay? Not much movement in that one from your ACL surgery, I'm guessing.
It did good, ain't it? Ooh, actually, my ACL, I think they took some of my patella tendon.
Oh, did
I
they?
think.
When they did the surgery?
Mhm.
Oh. That's good to
Patella
know.
tendon graft.
Okay. Let me write down those. Okay, now I just want to look at your meniscus. I'm going to start on this side over here. So I'm just going to move your leg. You just stay there and relax, okay? Any pain with that? Okay. You let me know if at any point this reproduces that pain at the top of your knee. Same thing on this side. Any pain with that? Felt a little clip.
It's a little tight though.
Okay. Next, patients don't ever really like this one, so I'm sorry. But what I'm going to do is I'm going to push on your patella and then I'm going to ask you to contract your quad, okay? Okay, you can contract. Any pain with that?
Yes.
You do have pain on this side?
It does hurt, but
Is it reproducing the same pain that you came here for? Okay. It's a painful test. I don't like it either. But it helps us rule in and rule out some things. Same thing on this side.
it feels like my quad is tight over here.
Quad is
but
tight.
it
Felt
can't
that
hide the
click
pain.
again.
Don't know why am I clicking.
Do you hear clicking and everything when you walk?
I do get clicks when I squat.
When you squat?
Mhm.
When you get down deep or just in the middle?
I would say from the middle on down, just clicks away.
Okay.
What could that be?
You know, it could be a number of things. My knees do that too, and I have no idea why. When I get out of bed, my knees crack.
Pick and choose the days and the times they want to crack.
Yes. I guess we're just getting old. Okay, I'm gonna go to this scene over here. I'm gonna do some mobilizations. You said, you said that it's painful when I push your knee towards your toes, right?
It does feel tighter, yes.
Okay.
Like you're pulling out the muscle.
Okay. What I'm gonna do is I'm just gonna do a couple what we call grade 1 and 2. This is supposed to help with pain.
Mm-hmm.
All I'm doing is just barely pushing on your knee, okay? And I'm gonna oscillate it like at the bottom. Does that feel okay?
Yes.
Okay. I'm gonna do that for about 10 seconds. Okay, I'm gonna do that just 3 times today. We're gonna start light since your injury just happened 2 weeks ago. I just wanted to get this out of the way while you're laying down. Okay. Does it hurt when I touch your quad right there?
Yes.
It does. It's painful. And it's a little swollen. Okay. Let me write that. Okay. I'm gonna have you fill out this outcome measure. This is just gonna help me write goals and just see what you're limited in.
Yes.
This is called the LEFS. Just answer those questions real fast, and I'm gonna write the rest of the stuff down, okay? You let me know when you're done.
What's time is it?
We're at 31.
I'm moving and everything.
Okay, thank you. Make sure everyone's safe. Good. Perfect. Thank you. Okay. So based off of everything you told me and the special tests that we did, your motion and your strength, you have signs and symptoms that are consistent with what we call quad tendinopathy. And what that means is you have a tendon that runs from the top of your kneecap into your quad muscles right there. And sometimes, especially since you're a runner, it gets overused and it can get irritated and inflamed, and that can explain why you're using your opposite hip to kind of compensate for taking things off of your knee to make it not hurt. It also accounts for the swelling and the how it's painful to touch and how your joint is moving and everything. So what we're gonna do, since it just happened 2 weeks ago, we're gonna start light just to help with pain reduction. The goal for this is just to decrease your pain, help maintain your strength, and maybe work on strengthening your glute med over here to help with the compensation. And we wanna improve your tolerance to loading, which is like when you walk down the stairs, you're eccentrically loading your quad. And that's hard on the tendon, so we wanna work on strengthening everything before going too hard on that stuff. We are gonna start today with some exercises that might leave you sore.
Okay.
But the goal is just to really decrease your pain for the first 2 weeks, and then we'll progress to what we call phase 2, which is strengthening, and we'll start doing all that loading to your tendon and stuff like that. Does that make sense?
Yes.
Okay. So let me just make sure. Do you understand what I'm saying about the tendon? How it's basically just irritated?
Yes.
And okay. So what we're gonna start with is I'm gonna have you lay back, and I'm gonna address your glute first and get that out of the way, and then we're gonna work on the quad. So we're gonna start with a band. I'm gonna put this around your feet. And I'm gonna have you lay with this side on top, so you can face that way. And what I want you to do is bring your foot as high up as you can while keeping that knee straight, and just brace your core the whole time you're doing it to make sure you're not compensating. What this is gonna do is it's gonna work on that muscle where you're feeling the hip and the back working. Help get it stronger so it doesn't start hurting your back and your hip. We're gonna do 3 sets of 10 of this, and I want you to do this 2 times a day. We'll just start with 10 for now.
It's 10.
Okay. Did that feel okay?
Yes.
Okay. The next thing I'm going to do is I'm gonna have you put your shoes on, and we're gonna stand up. We're gonna go to this wall back here. Well, actually, we're gonna go to this. The board's kind of getting in the way here.
Yeah.
We're gonna go. Let me make sure this is safe.
I don't think it is, Casey.
Yeah, you're right. We're gonna go back here in this corner of this little piece of wall.
Perfect.
And what we're gonna do is we're gonna do a wall sit. I want you to go as far down as to where you don't feel pain. I don't want you to do this in a painful range. I want you to do it right before you start to feel that pain, and we're gonna hold it for 30 seconds, okay? Does that make sense?
Yes.
Okay. So we're gonna do this 4 times 30 seconds. If you can hold 30 seconds. If that's too long, we can start with smaller holds. 30 is a lot.
I think I can do it 30.
Okay. You're better than me.
I like challenging myself.
Yeah. We just don't want you to be in too much pain when you leave. I want you to walk out of here. Do you have stairs in your house at home?
Yes.
Okay, so we would do those 4 times for 30 seconds. I'm gonna put all this on a piece of paper for you to remember.
Okay.
This one's gonna be fun.
Okay.
I want you to do it next to a wall just in case. We'll do it here. What I'm gonna have you do, it's your left knee, so we face this way, is we're gonna stand up on the stair, and we're gonna slowly, gonna do it this way actually. You can do it both ways if you wanna be symmetrical, but we're gonna slowly lower and tap our heel on the ground. I want your left knee to be on top, and what this is gonna work on is that going down the stairs motion where your knee feels unstable, okay? So we're gonna do this 3 sets of 10 also. If that's too much for your quad today, let me know if you're feeling that pain too much. But I want you to be able to walk down your stairs feeling safe.
You hear it pop?
I think I do at the end.
It pops at the end too. Pops going down.
Does it hurt?
No.
Just feels like it's
Yeah.
working.
Like it. Yeah. You did it.
That's your
Yes. I wonder what that is for real.
Yeah.
Like, I'm so curious.
We're gonna
It
have
sound
to
like
maybe
bone.
get some imaging on that.
It's been so long.
Have you had any imaging since your ACL? How are those feeling?
I feel good. I feel like it's working.
Okay.
I feel it in my glutes, my knee,
Everywhere?
my ankle.
Good.
This is very good.
It's a great exercise. It's just kind of hard.
Yeah.
Sometimes. You did say you're having a little trouble going up. So I'm gonna do the same thing. I want you to try to not hold on.
Okay.
But if you feel unstable, please do hold on. We don't want you to fall. I'm gonna move it out just a little bit. I want you to go up with your left knee. Yep. and then go all the way up and step back with your right knee. And now do the opposite, because we want to keep things even. And down with the left. We're going to do this one 3 sets of 10 also.
Come in physical therapy for real. Amazing.
Oh, thank you. We only got one more after this, and then I'm going to show you your homework, and then you get to get out of here. I do want to see you probably around 2 times a week for 6 weeks. We'll start with that if your schedule allows it, and we'll see where we are from there and with insurance and everything. I want to start with that to get through those phases of healing on your quad. Okay, I'm gonna have you can stay right there to hold on, but this is just gonna be a standing quad stretch. You've probably done it before being a runner. I just want you to stand. I want you to stand and pull your foot back like this if you feel unstable.
Do it on both legs?
Yes. 4 times, 30 seconds. Does that feel okay? Feel okay standing on that leg? Okay. When you're done with that, you can have a seat.
Everything cracking.
It's just aging, that's what I tell myself.
You are constantly growing, getting older.
Yeah, maybe you're hitting a growth spurt.
It could be that. We'll go with that, actually. I do like that idea.
Okay, so this is what I'm printing out for you.
Okay.
These pictures. This tells you exactly what to do, how long to do it, how many sets, and for the stretches it tells you how long to hold it. The pictures show you what you've already done. Just to make sure that you're understanding what we've all done, can you explain to me when you go home how you're gonna do the wall sit?
I go home for the wall sit. I'm gonna find a good sturdy piece on my wall, and I'm gonna lower into a squat before any pain.
Okay.
And I'm gonna hold that for 30 seconds 4 times.
Yes, perfect. Thank you for listening. Okay, well, I'll see you back in a couple days.
Okay.
Good luck. Thank you.